Hello, my name is Peter. The video that follows is in two parts. The first focuses on integrating the I, love, you, mnemonic, within a gentle back massage, focusing on an area of the lower back rather than massaging the tummy directly. The second part of the video is about teaching a patient or a family member a very simple tummy massage that you could do for yourself rather than have someone else do it for you. And the idea again is using the I and the L and the U to guide you in terms of the gentle strokes to aid digestion and to aid excretion. Thank you.
So I'm just putting the towel on your back and just smoothing it on. So thank you for being my model today, and I'm going to demonstrate working the tummy from the back, and the aim is to encourage normal processes of peristalsis in the tummy. So in shiatsu, this area is called the sort of the back of the hara, if you like. But obviously you need to think in your mind's eye of the intestines and the small intestines at the front. So I'm working from behind. What we know with working with infants is that often massaging the lower back, and particularly the little circles here either side of the sacrum, often does stimulate peristalsis. And if a child needs to burp wind, sometimes that helps just to sort of move things in the system, the gases, etc. So I'm going to demonstrate a little technique that I call I love you. So, and the letters in English obviously symbolize the movement. And when we're thinking about massaging someone's tummy, or if we were doing someone's reflex points on their hands and feet, we often think about working the large intestine, and particularly the area leading to the anus, so that we're actually moving things forward and then following it behind, if you like. So we're tackling the transverse colon and the ascending colon, and then obviously the idea of starting with the descending and the anus area, in a sense, on the map is to encourage that movement forward and then bring whatever's in the gut behind. Okay, so I'm going to demonstrate I love you on the back first. So here we go. So I'm actually just gently doing some massage anyway, just to make it comfortable. But this is something that you could teach a carer, for example. So I'm going to just cross over to the other side. So we need to think about Stephen's side of the body, which is right or which is left. So we've got right arm and we've got left side. So we're going to start by working down the left side. So I'm just very gently using the heel of my hand just to do 6 downward strokes. Okay, so we're just doing 6 and we're going right down to that nice soft bit of the buttock there. So we're doing 6 strokes down. Okay, lovely. And now we're going to do the 6 of the L-shaped movement. Okay, so I'm just doing 6. I'm starting with that little soft bit there, and I'm just bringing up and across. Okay, up and across and across and across. We'll just do one more. So I'm just coming up and across. So that's the I and that's the L. And now we're doing the U. So I'm just going to reverse it. And I'm just encouraging flow using the U. So you can do it that way. Okay. And you can do it the other way. So I usually start with one way and then I finish with the other way, because again, I'm aiming to empty all the time. Okay, So we're doing approximately 6 movements on that way. And so these dimples here are very good areas to work. And obviously when you work in this area, you're also working some very interesting bladder points to do with acupressure and acupuncture, but we're just doing it with soft tissue work over a towel, okay? You can finish by placing your hand in this, at the lower part of the spine and just encourage a comfortable breath in. Breathing in and then letting the breath go and just leaning in and giving a little bit of a rock. Okay, breath in and release the breath. You continue to do that for maybe 3 or 4 breaths, just gently rocking, and you can do some gentle movements just to complete. And that is I love you in the lower sacrum.